Hello everyone, my name is Snehal Desai and I'm going to go over a few topics here in this NAPLEX review course just to finish up on the previews on the respiratory section um, of this NAPLEX review course. So the first one, I'm just going to briefly talk about pulmonary embolism. Now, I've already kind of discussed it previously when we talked about um, like deep venous thrombosis and like blood clots and all of that, especially in the cardiovascular lectures. Um, but instead, deep vein thrombosis, this is pulmonary embolism. So you'll kind of see the mechanism here, but the medications are essentially the same as the ones you would use for DVT. Um, so let's take a look. So again, as I mentioned earlier, these are some of the topics that are covered generally in terms of the respiratory section on NAPLEX. At least having briefly an idea as to what type of medications are used in each disease state is important. So just pay attention, know what each medication is and how they work, um, so that you understand the mechanisms of them all. And so let's wrap up this lecture here by talking about briefly on pulmonary embolism. So here, the blood clot, it comes from the legs or the deep vein thrombosis, and then moves up to the right heart. Um, and what happens here? The clot forms in the deep vein, travels to the right heart, and then lodges in the pulmonary artery. And so when that happens, it's kind of blocking that airflow. So it's going to cause pulmonary blood flow to decrease oxygen exchange, increase strain on the right ventricular part of the heart. So that's going to possibly lead to right heart failure there. And um, so it's important to have an to treat this early stage so it doesn't affect the rest of the other organ systems like the heart, the lungs, the right heart, pulmonary artery, and other tissues where the blood flows to um, other organs. So, some of the symptoms a patient may get when they experience pulmonary embolism are things like chest pain, shortness of breath. They might get fast heart rate or tachycardia, or like irregular fast heart rate. And then you got leg pain and swelling that's still present since it's coming from the deep vein thrombosis as well. So there could still be some clot there and clot in the pulmonary embolism. So you might have two different clots here occurring at the same time or at different times. But um, it's important to treat it earlier in the stage before it reaches this part where patient is now going to experience shortness of breath and chest pain and all of those other complications and comorbidities. So, in terms of treatments, as I mentioned, and as you see in the picture here, anticoagulations like heparin and DOACs, which is a direct oral anticoagulants, are typically used to break up that clot so that the blood can flow in through the arteries, um, so that the rest of this like oxygen exchange and then there is less strain on the heart and everything. So when these medications are taken, it will help relieve the patient from all those kinds of symptoms that they experience when they have pulmonary embolism. So already discussed these treatments mechanisms, so I'm not going to discuss them again. Um, you would just have to see the cardiovascular lectures on these. But we basically already talked about a lot of these, like fracture heparin, low molecular weight dampening. I mean, you already seen how they kind of interact with factor 10 uh, and direct oral anticoagulants, um, as well as thrombolytics. So just take a look, just go back to the previous lecture and take a look if you want to have a quick refresher on the mechanisms. I have already briefly talked about it, so you can kind of just um, go straight to those lectures there. But it's pretty much straightforward and shouldn't be too much too difficult in understanding them. There's a lot of overlapping between some of these mechanisms, so you shouldn't have too much of a hard time with these. Um, so anyways, with that being said, that's pretty much it in pulmonary embolism. Not too much to be discussed here. Um, we briefly already talked about the symptoms and all, and treatments. So I think that's pretty much it on this preview here on pulmonary embolism. So let's look at sleep apnea. So sleep apnea is essentially repeated episodes of breathing cessation during sleep. So breathing is going to pretty much stop during the sleep, and that's when sleep apnea occurs. If you look at one of my shorts, um, obstructive sleep apnea is essentially upper airway collapse when upper airway collapses during the sleep. And one of the medications that was just recently approved, sometime around September this year, was Zepbound. And Zepbound is it's one of the most common medications that now people are using for like weight loss. But now it's also being indicated to be used to help treat obstructive sleep apnea. And uh, how it works is pretty much it's simple. It's like it's basically going to work in the same way as it treats for weight loss, but instead of the like the instead of interacting directly with like GLPs, it does interact with GLPs and GIPs, but in a different way. Like instead, you might see a little bit because sleep apnea, there's going to be a fat buildup inside the upper part of the respiratory system, so around the neck area, and then like the breathing would be hard for the air to flow um, in and out through the um, uh, like the um, trachea, or the very upper part of the um, respiratory system. So, with someone having sleep apnea, they might experience snoring, daytime fatigue, morning headache, large neck, and that large neck due to like all that fat buildup around it. So, Zepbound would be a very useful drug to break down that fat and make it like normal. So patient would be losing weight, but they would at the same time they could also prevent sleep apnea by taking that medication. And central sleep apnea is just decreased respiratory drive, but it is it's it's one of the medications that's just recently approved. And but other than that, the first line therapy is usually just using a CPAP. There isn't any real medication treating sleep apnea. Um, it's just used to help improve sleep, basically. A patient doesn't experience like shortness of breath, hypoxia, and those kind of things while they're asleep. So these are some ways to kind of mitigate or make patient feel better when they're asleep. However, the first line therapy is CPAP machine, and this patient would have to use the CPAP machine to make sure that they're getting the breathing while they're asleep. And that's pretty much it in this lecture. And I'll have some questions uh, on all the content we have discussed in this respiratory section, as well as a cumulative, uh, you know, questions that will relate to the lectures in this respiratory section, but I will also have questions related to cardiovascular and endocrinology, so that you guys are a little more prepared for the exam time, at least with the comprehensive review questions. Um, you guys should be okay for the exam and understanding these mechanism of action. So just want you to take some time and look through every lecture that I have already discussed since the beginning of this course, and think about uh, the pathways in which this disease occurs and how the medication works, because a lot of questions are going to be about the mechanism of actions. You might have some questions on like side effects and other relevant topics that you might have read in your course book or in your NAPLEX materials. Um, and yeah, so um, I hope that this review so far has been helpful for all of you, and that um, we can continue with this review and finish it. So you guys are very well prepared. I will be posting a lot of questions so that you guys are well prepared before the exam. So I wish you all good luck, and I hope you have a good day. All right.